Hello there. How are you today? That's great. I'm glad to hear. I also hear that you are a new patient. Fantastic. Well, for new patients, we first like to just start off by getting some information off you. So I'm just going to write down on my little clipboard here and ask you some questions, okay? I'm just going to first find your appointment booking here, okay? Okay, here it is here. Okay, and can I just ask your full name, please? Okay, perfect. And can I grab your date of birth? Okay. Excellent. And can I grab your address, please? Excellent. And just a brief medical history. Absolutely. I'm just going to just jot some notes down when you talk, okay? Okay. Yeah, no problem at all. All right. That is perfect. That is all the questions I have for you. Do you have any questions for me at all? Oh, you're okay. So you are scheduled for a cranial nerve exam, but you're not exactly sure what a cranial nerve exam is. Absolutely, I can give you a rundown for sure. So, a full cranial nerve, which is what we'll be doing today, a full cranial nerve exam assesses the cranial nerves in each specific area, which has a specific function related to the sensory and motor pathways. The exam involves tests visually, testing your pupillar's response, as well as eye movements, facial movements, facial twitches, your hearing, your swallowing, your tongue, your shoulders, your neck, really everything in the upper area, okay? And this comprehensive assessment provides valuable insights into the functions of the cranial nerve and helps identify any potential neurological defects. Absolutely, it's my pleasure. So, we're going to do a bunch of different little tests, like I said. And as we go through, feel free to ask questions then as well, okay, of any of the tests, and I will go over them before we do them, okay? Perfect. So, now that we've got that all taken care of, let's get started. All right, first, I like to start with using my stethoscope here. And we're going to listen to your breathing as well as your heart, okay? So I'm going to take this end here and I'm just going to put it on your back, okay? And I'm going to get you to just take some deep breaths for me, okay? And Take a deep breath for me. Okay, perfect. And just on the other side here. And just take a deep breath for me. Breathe. Okay, perfect. And just one more time, just on the front of your chest, okay? Just right here. And just deep breath in for me and breathe in and out. Okay, perfect. And just once more, just on this side here, okay? Deep breath in and breathe out. Okay, perfect. Everything looks good with that there, so I don't think we have to worry about your breathing, and your heart seems to be in great working order, okay? And we are going to get started with the first one. So, the first nerve we're going to be doing with our cranial nerve exam today is called the olfactory nerve. And basically, it's the smell detector. So, I have 5 different scent cards for you, okay? And we're going to scratch each one of them. All right, let's get started. So, first, I have these 5 cards here. And I'm going to give them a little scratch with this brush, okay? And we're going to then allow you to sniff them, okay? They are rather familiar smells, yes. All right, give this first one a smell here. And what does this one smell like? Yes, smelly goblin. You got that one right. Good job. And we will move on to the next one. I put that one aside so it doesn't interfere with any of the other scents here, okay? So we'll get started with this one as well. And what does this one smell like? A birdcage close, yes, the feather of a bird. You got that correct. All right, are you ready for the next one? Okay. forces. That is correct. You've got that correct. Good job. Okay. The next one here. All right, I'll give this one a sniff. Wet dog. You are on a roll. You've got that right. Yes, wet dog. And are you ready for the very last one? And the very last one, can you tell me what this one is? A robot's bathwater? I'll give you that one because you do have it with robot. You got it. Your olfactory nerve seems to be in perfect working order. Your smell, it seems to be on point. It's almost scary. Okay, yes. Yep, we will move on right to the next one, which will be the optic nerve, okay? So this one will be involving the eye chart. I'll be doing some light response tests with the pupils, okay? And a few other tests as well, and I will describe them as we go along, okay? Perfect. Okay, let's see here. I need these. I think first we will start with the eye chart here, okay? And then we will move on to the light responses, okay? So first we're gonna just do the very basic eye test here, okay? The one that I'm sure you've seen many times. I'm just going to point to a letter, and I'd just like you to repeat back that letter to me, okay? To make sure you can confirm that you can see it, okay? And just starting at the top here. Yes. And what about this next row? Correct. Excellent. And this third line? Excellent. And what about the fourth line here? Perfect. And the fifth line? Perfect. Great, great. And just this sixth line here. Perfect. Okay. And can you tell me what color this bar is right here? Excellent. And what about this one down here? Good, yes. And what about this one just right up here? Yes, excellent. Okay, so next, we're just going to see if you can take on this row 7 for me, okay? Good. Good. Great. What about this 8? Do you think you can make out any of that? Perfect. Excellent. 2020 for sure. Can you see any of the other columns below here? Any of these ones at all here? You want to give it a try? Okay. Not quite, but we'll just move on to the next one. Okay, good. Good. Not quite, but we'll move on to the next. Good. Good. So you got most of them correct. So you definitely say you have good 20/20 vision. Okay. So that's most of it that we can do with the chart there. Um, Next, we're just going to move on to some light triggers, okay? Just to test out those pupils, see where they're at, as well as your eye movement and your eye reactions, okay? So we're going to use my light pen right here, okay? It is rather bright, so please be aware. And basically, to start, I'm just going to have you looking away from the light, okay? So I'm going to point the light just in this top corner here. And if you can just look in the opposite direction, just in this direction, okay? I'm just going to take a look at the sides of your eyes, okay? Just a little response. Keep looking in that direction. Keep looking in that direction. Perfect, perfect, okay? Now I'm just going to switch it up and I'm going to point it in this bottom corner here. And I just want you to look the opposite in the top corner way, okay? Good, good. Okay. Excellent. Good. Everything seems to be in order with the eye there. Okay. Fantastic. Okay. Perfect. Okay. Everything seems to look like pretty well with each eye around the pupil. Okay. And in the corners around and the veins as well seem to be all in perfect order. So we're going to move on to the next one. And this one is going to involve my finger and this light, okay? What I want you to do is focus on this finger right here, okay? I'm going to present the light in different fashions throughout this session. And I want you to just stay focused on the top of my finger, okay? Basically, I'm just checking for light response and light eye response, sorry, and light movement, eye movement. Keep saying light. And from there, I'll be able to see if your eyes are able to continue focusing with the distracting light in the back, or if your eyes continue to shift at all. Okay? So just keep an eye on that finger there, just the top of that finger, while the light swirls around, trying to distract you, okay? Keep from being distracted. Okay, keep from being distracted. Keep focused on the light and the finger, the top of my finger. Okay, perfect. Your eyes seem to be responding quite well to that. So what I'm going to have you do now is switch up. I'm going to have you look at the light. Okay, the light is going to stay and go in circular motions just right here. Keep your eye on it and avoid looking at the distracting finger that's also making circles, okay? So keep your eye on the light. Follow that light as best as you can. Follow that light. This allows me to check for the same thing as before the last test. But this one, because the light is involved and you're focusing on that, it changes your pupils. So I'm able to examine after the change with the light involved, okay? So keep your eye on the light even when it changes design. And just stay fixed on that light, okay? Fixed on that light. Don't let the finger distract you. Don't let the finger distract you. Okay. Now, can you tell me what's What's closer, the finger or the light? Good. What about now? Good. And what about now? Good. And now? Excellent. What about now? Good. And now? Perfect. And how about now? Excellent. What about now? Fantastic. And now? Perfect. Okay, and I think the last test we'll do that won't involve the light or the eye chart, I'm just going to hold up. I want you to focus just right here on my tie, the top of my tie, okay? And I'm going to hold up a certain number of fingers, and I'd just like you to tell me how many together, all together, okay? How many fingers are being held up, including thumbs? Okay? I'm ready? How many fingers? Good. How many now? Good. How many now? Good. How many now? Perfect. And now? Good, good. What about now? Good. And now? Excellent. And what about now? Perfect. All right. Everything seems to be good with your peripheral there as well, too. So we are going to move on to the next set of nerves, okay? And those nerves are the ocular motor, the trochlear, and the abducens. And basically, those will be covering more parts of the eye, but on a different scale, okay? Different connections within, as well as attached to the retinas, okay? So we're going to dive into that, and we're going to be using the light pen again. The first one, we won't be using it for light. The next test, we will be using it, but also associating it with colors, okay? So this first one, I'm just going to be making a simple H, okay? And I just want your eyes to follow along with that, okay? Just follow the pen making the H, okay? And I'm just going to see how well you keep up with speed, as well as how smoothly it is for you, okay? If it's a little more choppier than normal, okay? Perfect, okay? Good. Okay. Okay. That looks all right there. Okay, so it seems to move pretty smoothly along with the H. Perfect. Now I'm just going to pick up the speed just a little bit here, okay? Just examine your eyes. There we go. Okay. Perfect. Okay, everything looks good there. And you are able to keep up with the faster speed. Okay. And you don't have any pain or anything like that. Perfect. Okay, so everything looks good with that then. And we're going to move on to the next portion, which will involve the light penning well, and as well as these colors here, okay? So we're just going to start with the first one here. And I'm just going to make that H again. And I just want you to stay focused on the pen, where it's going, the flow of it, and the creating of the H as it traces on the paper here, okay? Stay focused. Perfect. Good, good. Okay. Yeah. Everything looks good there. Everything looks good there. Everything looks good. Sorry for any background noise that you may hear. Construction next door on the street there, next to the offices. Okay. Now we're just going to move on to the next color here. Okay, keep your eye on the lights here, okay? I'm just going to examine your eyes, sides, the top, and the bottom, and the other side as well, just to see if it moves and flows smoothly. And looking at this H here, okay? And as well as showing the different shades of color. Perfect. Perfect. Good. Good. Okay. That's excellent. Okay, everything seems to look good with that as well. So we're going to move on just to the next color here. We're going to go with a bit of a darker color. And then we'll move on to that very last, very bright color again, okay? So keep your focus on the age that is being created here, okay? Dr.Relaxa is here for you. Here to make sure your cranial nerves are in perfect working order. And I've been told that they are rather relaxing as well, so I like to keep up with that. Okay, and stay focused on the H. Perfect. You're doing a great job. I'm going to do it more up here. There we go. There we go. Okay. Keep an eye on those nerves and how they are doing. Perfect. Everything seems to look normal with these ones too, which is good. Perfect. Okay. Yeah, everything looks good with the blue color as well. So we're just going to move on to that last one, which is that lovely lime green here. Okay, and just keep focused on that age. Okay, I'm going to take a look at your ocular motor. Okay, seems to be reacting potentially in your abducens. All the nerves seem to be in working order. They seem to be functioning even at a higher rate, which is exactly what we're looking for. Perfect. Okay. Everything seems to be good with this color as well. So you've done very well on all 5 of the nerves so far, okay? The next nerve we'll be looking at is the trigeminal nerve, okay? And this one is the touch sensation on the forehead, the cheeks, and the jaw, as well as clenching of the jaw, okay? Just to make sure that everything is, when constricted and tight, that it all works, as well as elasticity when poking. And to do this, we are going to be using 2 instruments, a soft as well as it's not sharp, it's more bald, but it's a bit of a poke. That won't hurt at all. And it will determine, you'll be telling me if it's soft or dull by the poke, by the feel of it, okay? And we'll be doing that on your forehead, your cheeks, and your chin, just like I said, to see the elasticity as well as the touch sensation if you're still feeling them in all those correct spots, okay? All right, let's get started. So, I'm going to just start with the forehead here, okay? And you tell me if it's soft or dull, okay? Okay. Good. Good, good, good. Excellent. That is correct. Soft, yeah. And that is dull, soft, dull, correct. Soft and dull, soft and dull here, and soft and dull. Good, good. All the sensations seem to be well intact in the forehead, dull and soft. And now we're just going to move on to the cheek areas, okay? I'm just going to actually we'll start with one on each side, okay? Just so I can make sure you're not seeing which one I'm going over with each side with, okay? And which one here? Soft or dull? Good, that is soft, yes. And this one? Dull, correct. And soft, yes. And dull, yes. Yep, more dull. Soft, yes. Good job. And some dull, perfect. And soft and dull. Excellent. And I'll just move to the other side here now. Right, soft. What about now? Good. And soft. Dull. Perfect. Good. Good. Soft. Dull, dull, dull. Soft, soft, soft. Dull, dull, dull. And soft. Dull, soft, dull, soft, and soft. Perfect. And the last one will be just moving down to your chin, okay? Soft, yeah. Dull, perfect. Soft, 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 soft. And dull, 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 dull. Soft, dull. Soft, dull. Soft. And dull. Soft, dull. Soft. And dull. Soft. Dull, soft, dull, 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 soft. Yes, and dull. Excellent. Everything seems to be in working order with that. And for the last part of this, I'm just going to get you to clench your jaw for me, okay? Just clench it just like that. And I just want you to try and move from side to side, okay? Just like that, yeah. Just like that. Perfect. Okay? And just clench your jaw and just give me a big wide open smile, okay? Just looking at the tensions at your face here, okay? Perfect. Keep that grin there. Just gonna make sure things seems in working order. Yes, everything seems to bounce back as well. Perfect. You can release your jaw now. Okay. And now we're gonna move on to facial expressions, which kind of involves the jaw as well, because I'm gonna be asking you to smile, frown, make certain faces for me, okay? So let's jump into that. Okay, so I'm just gonna get you to start just by puffing out your cheeks with not, don't over puff them because it can cause some pain. So just enough just to puff them up, okay? Just to see if the facial expressions and muscles work with well, okay? So just good, good. And I'm just going to put a little pressure on them with it, okay? And just try and prevent any air coming out. Good, good job, okay? Good, okay. And now we're just going to move on to some facial muscles, okay? So you can just give me a big grin, big smiling grin. Good, good, okay. Everything looks good there. Everything looks good with the smile. Perfect, very lovely, very lovely. Okay, and now can you just give me a frowned face, okay? Okay, and I'm going to do the same thing. Everything looks good there. Some nerves here, okay. Perfect. Yep, and the resistance on them as well is perfect too. And now can you give me kind of a stern face? So scrunch your face, scrunch your mouth, scrunch your nose, just scrunch all in general, okay? Just like that for me. Perfect, okay? And now scrunch up, and I'm going to try and unscrunch it, okay? Not too hard or anything, but I'm just going to try and get some resistance going, okay? And just prevent it, okay? Ready? There we go. Yep, you're resisting me. Perfect. Good, good. You're resisting. Good job. Everything seems to work well. There. So everything with your facial expression nerves look fantastic, which are just the facial nerves. But we can move on to the next one. This next nerve is the vestibulocochlear nerve, okay? And this one is just the hearing. So I'm going to be whispering things on each side into your ears. And then the very last test, there's only two in this one, will be I'll just be tapping two wood blocks together. And you'll just be telling me if you can hear it on which side, as well as how many taps, okay? So we'll move on to the first one. I'm just going to whisper something into your ear, and I'd just like you to repeat it back to me, okay? ASMR. Excellent. And relaxation. Good, good. And stipple, 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 stipple. Perfect. Sweet dreams. Excellent. And cranial nerve exam. That is correct. What about this one? Tingles, 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 tingles. Good, good. And this one? Relaxation station. Perfect. And this one? Sleep. Yes, correct. And what about this one? Eye exam. Good. And last one. Subscribe. Fantastic. Excellent work. So yeah, we'll be moving on to the next one, which will involve these two little guys right here, okay? I'm just going to go on each side of your ear. I'm going to do a number of taps, and I just want you to tell me how many taps, okay? We'll start on this side. Good, good. And this side? Fantastic. This side again. Excellent. And this side? Perfect. And last two, this side? Yes, good job. And last one. Yes, perfect. So everything looks fantastic with your hearing, as well as your facial muscles and your jaw and your touch sensation in the trigeminal. Okay, so everything's looking great with all of your nerves thus far. We only have a handful of them left now, so we'll just try and speed them through so we can get you out of here. Okay, but you're doing fantastic, and I really appreciate it, and you. So the next nerve we'll be looking at is the glosso-pharyngeal as well as the vagus nerve, okay? And this one will be focusing on the palate and the tongue. So I'll be getting you to taste a few things, telling me what their flavors are, as well as testing with kind of like the old-fashioned stick in the tongue and say ah thing, okay? We're going to be looking at that as well as some of your tongue movements, okay? Perfect. So we will get started with that. Da, da, da. So right here, I have a spray. I have 5 of them in total. And what I'll be doing is spraying them on your tongue, and you'll be telling me the taste sense, okay? And don't worry, they will be a lot more pleasant than the smell ones that we had, okay? Let's get started with this, okay? I like to give it a little shake just to give the flavors a little awakening here. Okay, and if you will just open your tongue like that for me, okay? And I'm just going to be giving it just a couple sprays here. Okay? And what does that taste like? Apple, yes, correct. Good job. Let me just grab the next one here. Okay. Give a little shake quickly. Okay. You can just stick out your tongue for me. Okay. And what does that taste like? Banana, yes, you are correct. Good job. I'll get the next one here. Okay. Okay, and if I can just get you to stick out your tongue here. And what does this taste like? Yes, grape. Excellent taste. Okay, we'll just grab the next one here. Quick little shake here. Okay. And if I can just get you to stick out your tongue and tell me what this taste is. Orange. Yes, you are correct. You are 4 out of 4 for right now. Grab the last one here and let's see if we can make it 5 out of 5, shall we? Okay, and stick out your tongue for me one last time. And what does that taste like? Cherry, you are correct. Good guess. You are 5 out of 5, and those nerves seem to be in perfect working order. Okay, and we're just going to do that last one. I'm going to be doing is I'm going to be taking my sterilized instrument here, and I'm going to be just putting it just gently on your tongue and pushing down. I'd like you to, like the old-fashioned, say ah for me, okay? And we're just going to test. I would like you to move your tongue from one side to the other so we can see it how well your tongue nerve is doing in there, okay? Just say ah, perfect. Okay. Everything looks good. And just move your tongue to the left there. Excellent. Move your tongue to the right. Okay. Perfect. Everything looks good in there too. I'm not really worried about that. The back lining of your throat looks intact, as well as your uvula, so I'm not too concerned with that. Your tongue motions seem to be moving smoothly and no obstructions there, okay? So we're just going to move on to some of the last nerves we have to work on today, okay? And that next one is the spinal accessory, okay? And this one is basically turning resistance, kind of like how we were doing earlier with the jaw and the face expressions. But this one, I'm going to be moving your entire head, okay? But you're going to be resisting me, okay? So I want you to look straight forward, focus at my tie here. And I'm just going to put my hands gently on your head and gently try and push and pull and move to the sides, okay? So just prevent me from doing that, all right? So here we go. Good, good. Resisting me from doing that. Good, good. And each move to the side. Doesn't seem obstruction, and you don't feel any pain from the resistance at all. Good, okay. Now I'm going to move your head slightly up now, okay? Good, resist, perfect. And just down a little bit. Okay, perfect. Yeah, everything seems to be good with that. And from what I saw with your jaw, I'm not surprised there. So everything looks good with the spinal accessory, okay? And we will move on to the very last one, which is just a little bit more of movements of the tongue as well as checking for symmetry, okay? And this one is the hypoglossal nerve, okay? And this one we are going to be just basically examining with my trusty light pen here, okay? So I'm just going to get you to open your mouth wide. I like that, yeah. And I'm just going to get you to move from side to side, okay? Okay. Good, good. And do you mind lifting the tongue right up to the ceiling there? Good, perfect. Okay, good. Everything seems to be connected there still. Everything looks intact. Nothing looks out of place at all, okay? And now can you move it up and down for me? And you don't feel any pain, any restriction or anything like that? Okay, good. Fantastic. And now just go from side to side again. Okay, look on this side while you're doing that. And this side here. Okay, perfect. And now if you could just stick out your tongue, just gently, you don't have to stick it all the way out, just gently stick out your tongue so I can just see the symmetry of it, just to make sure that there are no growthing happening on either side, as well as that could be affecting those nerves, okay? Perfect, okay. Well, it looks pretty similar on each side. No growths, no extensions or anything like that. Nothing to be concerned about at all. Perfect. Perfect. You can put your tongue in your mouth. Fantastic. And that is the cranial nerve exam, the full cranial nerve exam. How did you find it? Oh, good. I'm glad it was. I've been told it's a little relaxing at times, so I try and keep with that aesthetic. Okay. Fantastic. I'm glad. I'm so glad. Okay, yeah, well, I'll let you get out of here because I've taken enough of your time today. Perfect. Well, I hope you have a wonderful day and please stay safe out there, okay? All right. Take care. Bye now.